Welcome to the Navy Reserve Post-Mobilization TRICARE Benefits Briefing. The goal of today's presentation is to explain how to use the post-mobilization TRICARE benefits you've earned. This brief will inform you about the options and processes necessary to maintain continuous medical and dental coverage for you and your dependents through demobilization and transition from active duty back to civilian life and cell res status. TRICARE has many programs that let reserve members and their families enjoy continuous coverage throughout the TRICARE eligibility lifecycle. When active duty orders for more than 30 days are executed in support of contingency operations, dependents become eligible for premium-free active duty TRICARE benefits as well as their sponsors. These benefits continue throughout active duty service, which includes the demobilization processing time and any terminal leave accrued through your mobilization. Once active duty ends, sponsors and dependents may become eligible for 180 days of transitional medical and dental benefits through the Transitional Assistance Management Program, or TAMP. After TAMP, you may enroll in TRICARE Reserve Select and the TRICARE Dental Program, or re-enroll if you used these programs prior to being mobilized. It is extremely important to note that all TRICARE eligibility is based upon what is reflected in DEERS. If your status is listed incorrectly or your dependents are not accurately reflected, this can impact your eligibility until you resolve any discrepancies. Be sure to check MilConnect to verify your DEERS information is correct. TAMP medical coverage options include TRICARE Prime, TRICARE Select, U.S. Family Health Plan, and overseas options. Each option will be covered more in depth during this brief. There's no enrollment fee, but cost shares and co-payments may apply. Please note, TAMP does not cover TRICARE Prime Remote or Line of Duty Care, which is a benefit that provides care for injuries and illnesses sustained on active duty periods of less than 30 days. During the TAMP period, TRICARE program options will depend on location. TRICARE Select is available worldwide. TRICARE Prime is available to beneficiaries living in Prime Service Areas, or PSAs, in the U.S. and areas near military hospitals or clinics overseas. PSAs are areas near military hospitals or clinics and civilian provider offices where regional contractors have established TRICARE Prime networks. Please note, no enrollment action is required for purchased care coverage to apply for TAMP. TAMP beneficiaries who live in a PSA may change their enrollment from TRICARE Prime to TRICARE Select or vice versa. Family members living in certain areas are also eligible for the U.S. Family Health Plan, or USFHP, which is a TRICARE Prime option available in 6 designated areas across the U.S. For information on TRICARE program options overseas, please go to www.tricare.mil overseas. Note, TRICARE Prime Remote, TRICARE Prime Remote for active duty family members, and TRICARE Overseas Program, or TOP, Prime Remote are not available during TAMP. TRICARE is available worldwide and managed regionally. There are 2 TRICARE regions in the U.S., TRICARE East and TRICARE West, and 1 overseas region with 3 areas, TRICARE Eurasia, Africa, Latin America, and Canada, and TRICARE Pacific. Benefits are the same regardless of where you live, but there are different customer service contracts for each region. HealthNet Federal Services, LLC administers the benefit in the West region, and Humana Military administers the benefit in the East. Both regional contractors partner with the military health system to provide health, medical, and administrative support, including customer service, claims processing, and prior authorizations for certain healthcare services. Contact information for each region will be provided at the end of this presentation. TRICARE Prime options provide affordable and comprehensive healthcare coverage while minimizing out-of-pocket costs. Enroll or re-enroll by visiting the tricare.mil enrollment page listed on this slide. TRICARE Prime enrollees have a primary care manager, or PCM, assigned at a military hospital or clinic or within the TRICARE civilian provider network. PCMs deliver routine care such as preventive services and routine visits and file claims on the beneficiary's behalf. TRICARE Prime enrollees who need specialty care are required to work with their PCMs or regional contractors to coordinate referrals and prior authorizations. Urgent care services are medically necessary services required for an injury or illness that would not result in further disability or death if not treated immediately, but does require professional attention within 24 hours. A referral for urgent care visits for TRICARE Prime enrollees other than active duty service members is not required, and point-of-service charges no longer apply for such claims. For emergencies, call 911 or go to the nearest emergency room. Referrals and prior authorizations are not required for emergency services, but, if admitted, your regional contractor must be notified within 24 hours or on the next business day to coordinate ongoing care. With TRICARE Select, you can see any TRICARE authorized provider, but you save money when you use network providers. You must be registered in DEERS, and enrollment is required. There is a yearly deductible for TRICARE services, and you pay cost shares for most services. Referrals are not required for most healthcare services, but some services require prior authorization from your regional contractor. Visit www.tricare.mil/select for more information and costs. When using TRICARE Select, your out-of-pocket costs will be lower when you see a TRICARE network provider. A network provider is a provider that accepts TRICARE's payment as the full payment for any covered healthcare services you get. TRICARE network providers also file claims for you. To find a network provider, go to www.tricare.mil/find-a-provider or contact your regional contractor. If you are seeing a non-network provider, ask if he or she accepts TRICARE and is authorized to get paid by TRICARE before getting care. If not, invite the provider to become TRICARE authorized at any time. The provider simply needs to contact your TRICARE regional contractor for more information. Beneficiaries who see non-network providers may have to file their own claims. If you are overseas, you may get care from any purchased care sector provider or military hospital or clinic on a space available basis without a referral except in the Philippines, where you are encouraged to see a TRICARE preferred provider for care. The TRICARE Select deductible is waived for reserve family members during the mobilization period, but is applied during TAMP. The catastrophic cap is the maximum amount you pay out of pocket for TRICARE covered services per calendar year. The $1,000 cap includes deductibles, cost shares, and prescription copayments, but does not include TRICARE Reserve Select premiums paid prior to active duty. Sponsors and their family members are responsible for copayments. This is the amount you pay for TRICARE covered services, which vary depending on which providers are seen. For the most up-to-date cost information, go to www.tricare.mil/costs. Enrollment is required for TRICARE Prime and TRICARE Select coverage of family members. There are 3 ways to enroll. Enroll online through the Beneficiary Web Enrollment, or BWE, website accessed through MilConnect, where you can also update DEERS information, which must be accurate in order to maintain eligibility for appropriate TRICARE services. Members commonly report DEERS reflecting inaccurate information during the course of transitions between active duty, TAMP, and back to cell-res status. Discrepancies reflected in DEERS are often resolved automatically by the system in due course, but if they remain unresolved, they must be addressed by the member using the DD-214 or endorsed copies of MOB and DEMOB orders for member status verification. Coverage dates will always be retroactive to the date of separation, even if there are issues with DEERS properly reflecting eligibility at the start of TAMP. Call your regional contractor, download a form from tricare.mil/forms or your regional contractor's website and mail the completed and signed form to your regional contractor. If overseas, you may submit an enrollment request at a TRICARE service center. The TRICARE Young Adult Program is a premium-based healthcare plan available for purchase by qualified, unmarried dependents of TRICARE-eligible sponsors. TRICARE Young Adult offers TRICARE Prime and TRICARE Select coverage worldwide, and eligibility is determined by the sponsor's status. TRICARE Young Adult includes medical and pharmacy benefits but excludes dental coverage. Adult children may qualify to purchase TRICARE Young Adult coverage if they are all of the following: unmarried dependent of a TRICARE eligible sponsor, at least age 21 but not yet age 26, not eligible to enroll in an employer-sponsored health plan based on their own employment status, not otherwise eligible for TRICARE program coverage, or not a uniform service sponsor, for example, a member of the selected reserve. For TRICARE Young Adult qualification, cost, and enrollment information, go to www.tricare.mil/TYA. The U.S. Family Health Plan is a TRICARE Prime option available through networks of community-based, not-for-profit healthcare systems in 6 areas of the U.S. Go to www.usfhp.com to find out if you are in a designated USFHP area or to enroll in USFHP. USFHP provides comprehensive coverage, but it is important to note that beneficiaries enrolled in USFHP are not eligible for any other TRICARE benefits, including pharmacy, dental, and military hospital or clinic care. Healthcare coverage for CellRes after TAMP. TRICARE Reserve Select is a premium-based health plan available for purchase by qualified members of the selected reserve and their dependents. You will not qualify for TRS if you are eligible for or enrolled in the Federal Employees Health Benefits Program based on civilian employment. With TRS, member-only or member and family coverages can be purchased. You can purchase coverage the following ways: online by using the BWE website via MillConnect or by calling your regional contractor. Remember to use the phone your contractor option if you run into any issues with your status not being updated in DEERS to reflect the upcoming expiration of your TAMP benefits while attempting to enroll using the beneficiary web enrollment option on MillConnect. Dental coverage while using TAMP. The sponsor will continue to receive free dental care at military dental clinics while using TAMP. If the sponsor lives more than 50 miles away from a military dental clinic or is referred by a military dental provider to a civilian dentist, they will automatically be covered by the active duty dental program. Enrollment is not required, but be sure to acquire an appointment control number, or ACN, using United Concordia's website before using a civilian provider, unless you were referred to that provider by the military provider. The TRICARE Dental Program provides premium-based coverage for dependents. If already enrolled during activation, no action is required. The active duty premiums during TAMP are reduced, but will revert back to reserve premiums upon expiration of TAMP benefits if the family continues to use the TRICARE Dental Program once the sponsor transitions back to CellRes status. Enrolling dependents in the TRICARE Dental Program during TAMP. Family members who were enrolled in the TDP during activation may continue coverage uninterrupted at the active duty rate during TAMP and at the increased reserve family member premium rate after the TAMP benefits expire. It is very important to note that you verify your premiums are being paid, especially if they were drafted from your active duty pay account during your mobilization, as this option will no longer be available to you. If enrollment is required, it can be accomplished using the BWE option on MillConnect, by phone, or by mail. Care is provided by participating dental care providers. To find a dental care provider, visit the TDP website or get a care from a non-participating dental care provider, which may result in higher costs. For more information, go to www.tricare.mil/TDP or call 1-844-653-4061. Finally, here is a handy list of all program administration points of contact. Remember that most actions can be accomplished using the MillConnect beneficiary web enrollment tool or by calling the contractor directly. Please also note that the CNRFC Navy Reserve Project Office may be contacted by email at NavyReserveProjectOffice@navy.mil for any mobilization-related TRICARE questions or concerns that cannot be addressed directly by the contractor. Be sure to keep your DEERS record accurate and up to date to avoid any issues with your TRICARE eligibility. Thank you for your service.